قاعد نفسه جمتين بالطريقة دي.
السلام alaikum. Welcome
أولادك
everyone on board.
هم جايبين بتاع زي دي.
Just a second, please. Okay. So my name is Dr. Zishan. I will be taking a session about some basic concepts, how to prepare for oral examination. So may I know just who is the exam candidate among you? Anyone who is appearing in the exam, or even anyone who want to volunteer? Sayyid Muhammad Shah, you have the exam. Okay. Actually, in oral examination, oral exam, whether it is for like FCPS or MCPS or MS, or whether it is an exam uh, anywhere in the world, the basic principle remain the same, because they will be usually there are two different sort of questions. One are scenario based, and one questions are direct questions about any phenomena, any equipment, anything. So direct questions and scenario based questions. So first of all, we will be, because direct questions are direct questions. Direct questions just need a bit of knowledge and concept, while the scenario based questions are the main challenging thing, and majority part of the oral exam, they are comprising of scenario based question. So the problem is that how to compose and compile your answer which is covering all the aspects of a scenario. That is the challenge which you have to bear when you are preparing for this oral exam. Okay, so so the basic thing which you should be knowing, that in scenarios, actually what they will be asking, well, one thing, there will be usually there will be a surgery. Okay, this is the common thing. The other thing will be, there will be a patient category. What do you mean by patient category? That patient may be elderly, obese, patient may be pregnant, patient may be pediatric, neonate, smoker, alcoholic, uh, and then you can make some more patient categories also, in the form of a patient with difficult IV line, patient with difficult airway management, patient with risk of bleeding. So you can make a list of the patient category. Okay, so either of the category will be there. So you have to consider things related to the surgery. You have to consider things related to that patient category. And the third thing will be disease, any disease. Okay, any disease will be specific disease category, even diabetes and hypertension, because it's so common. And I don't think so there will be any exam which will be finishing without this diabetes or hypertension. Or maybe they have put diabetic patient or hypertensive patient in addition to a disease. Okay, so this will be something which you need to combine. So whenever you are answering the question, you have to cover all those three aspects. This is the basic thing which you should be understanding, because like a very simple example will be that a patient, young female, who is 35-year-old, and she is known case of myasthenia gravis, and she's presenting for lab coli. I'm just giving you one example. So what concerns will be with reference to a young 35-year female will be that that patient can have OCPs, that patient can be pregnant, that patient can have so these are the things which you should be thinking, that this patient is more risk of PONV. Okay, so these two, 3 points will be everything, not necessarily everything will have 10 points, but you should be thinking that when they have make a part of it, so you have to consider all three these things. So this is what I am trying to tell you: surgery category, patient category, and disease. So when you are constructing your answer, you should be covering all these things. So one point, this I have told you, The other point, for example, is myasthenia gravis. This will be any disease. So any disease will have a little different perspective. But what you have to think is that what is the basic pathology of the disease and what is its relevance with usually organ system, especially anesthesia. So when you are thinking about anesthesia, you have to think about all the anesthesia steps. We will consider shortly how to figure out these things. Okay, so anesthesia steps and organ systems, especially whatever we are doing. Our main concerns is cardiovascular system, respiratory system, airway management, or regional anesthesia, whether we have to give spinal or epidural. That's what we do. Okay. And then next thing will be how to induce a patient, how to put a monitoring, how to give fluid management, how to take IV lines. So these are the basic steps. And at that patient is at risk of PONV, that is patient is at risk of aspiration. So these are the things which will be related to our anesthesia conduct. So whatever disease we are considering in Viva, they are expecting that you are telling the things which are relevant to anesthesia. Okay. I know that they like in my senior gravis, I never forget because this question was asked to me. One part of any other part is that they are jolting you, they are giving you a just shock just to check it out your mental capability, how strong you are. Because being an anesthetist, maybe in other fields as well, but being an anesthetist, you have to be very vigilant, you have to be very active, and actually they are checking your nerves, not only nerves that you are able to handle any unusual situation, and actually they are checking your nerves as because you are getting passing an exam and you will be a future consultant. So they just want to check it out whether this person is a capable enough of handling the situation, interacting with the patient, his family, his or her family, and other paramedical staff. Or so this needs, and actually they are judging your personality as well. Maybe you don't understand, but this is what people say, that a examiner does not like my face. It's not like that. Your approach is not good, and this is making your life difficult. Because maybe if a person who is looking very confident, he has good manners, maybe that person, even if he or she does a small mistake, maybe the examiner will overlook. But a person who is not looking good, maybe the examiner became a little more strict, and they are not letting go his or her mistake. Okay, so this is part of it. So like the question which they asked me, and maybe if I now, maybe at that time I was so upset that why they asked me this question, what is ice pack test. Okay, so ice pack test was asked to me with reference to my senior gravis, and now I can realize that maybe I was having the shock of my life, that what the hell this question was, and I was thinking that I was failed because of ice pack test. No, believe me, this was just a feeler. This question maybe have no marks. Okay, and this has nothing to do with your pass or fail. But you will find such questions asked in any exam, and please don't get distracted or expect such questions which are just to check out your nerves. Okay, so this is also part of oral examination. Okay, so similarly, now the third step will be for example, cholecystectomy. So any surgery which have, so you should be knowing what are the things which you should be knowing about that surgery. Okay, and there are some critical steps, whether that surgery has anything which are affecting your anesthesia management plan. Okay, then maybe that surgery which they are doing, you should, there are some critical steps in it. So you think about surgery, you think about disease, and you think about the patient category. If your answer is not covering all these three things, you will not pass. Number one. And now, what's the problem? That for one scenario, usually there are 5 minutes. Now, if we focus on table viva, which is, you can say, short cases. Some people say table viva, some people say short cases. And so, so in this, usually there are 5 minutes. So in 5 minutes, you have to cover all the things. So how to answer these things? Because maybe this patient, for example, I add a scenario, add something only in this air, pregnant. Okay. So now a pregnant patient with myasthenia gravis presented for lab chole. So now one more thing is added. So now what do you think they want to ask in this scenario? They want to ask everything about pregnant changes? No. So your answer in a way should be in a way that you are telling everything and you are saving the time. So a sample answer for this scenario will be, this is a pregnant patient which has the physiological, pharmacological, and anatomical changes affecting the anesthesia management in the form of difficult airway, risk of aspiration, high cardiac output, low requirement of anesthetic medications, low MAC, and low requirement of regional anesthesia medication, high risk of pulmonary embolism. I'm just giving you a sample that you have touched everything, and if they want to ask something detailed, you will finish it. So maybe in this portion, you just have to take 30 seconds to explain about pregnant patient. Okay. And if they want to ask something in detail, they will ask you. Otherwise, they will tell you, they will come to know that, okay, this gentleman or gentle lady knows about how to compile the answer. Okay. So this is example which I'm saying. So this is a task. Make your task 30 seconds to 1 minute answer for all the patient categories and diseases. Okay. I will come tell you you can make answer for such things for every. I will give you an example of myasthenia gravis. That myasthenia gravis is a neuromuscular disease effect because of autoimmune destruction of post-synaptic acetylcholine receptor. So there are no receptor for acetylcholine to act. So there is muscle weakness, and this is resulted as a result of autoimmune disease. So the patient can have another autoimmune disease. Patient may be taking immunosuppressant drugs which has systemic effects, and patient may be taking steroids, so we need to replace the steroids. And this patient can have all muscle weakness, but important for anesthetist is bulbar weakness and respiratory muscle weakness. Also there is ophthalmic weakness, but it is more for diagnostic purpose, and anesthesia is not much of relation. But you will be considering this patient for possible post-operative ventilation. So there are certain factors. If the patient has more disease progression, more disease duration, patient is taking a lot of pyridostigmine, patient has upper abdominal or thoracic surgery, and patient is having previous other comorbid respiratory disease, so there are more chances of post-operative ventilation. So I don't think so I took more than 30 seconds to 1 minute. So this answer should be in a way that you have to you can there is no science in it. You read a topic and make your watch working, and make an answer in which you finish everything main points within 30 seconds to 1 minute. So this is the task which you have to do, and nobody else can open your box of head and put it the answer in your mind. And even if you open whatever bloody books of anesthesia, this will not be a guarantee that you are able to make this answer. This is your own intelligence, and there can be no notes which can be replacement for it. You have to use your own brain, because you cannot cram these answers. You have to understand what is it. Okay. So I hope up till now, if anyone has got any question or any comments, please. Okay. So similarly, now the third step is for example, cholecystectomy. So the things which you should be knowing about cholecystectomy, that why they are doing cholecystectomy, whether there is inflammation, whether there is stone on a morning walk towards the biliary tree. Maybe patient has empyema gallbladder. Maybe the gallbladder has been ruptured. Maybe there is a CA gallbladder. Okay. And there may be involvement of pancreas and the liver. So these are very simple things. You can just tell that whenever patient is coming for cholecystectomy, we have to rule out these things. And again, please don't dig out a hole for yourself. Don't go into too much details. You just have to tell them a flash, you can say advertisement. Okay. You can say like now in this we get in teasers. So this will be a teaser, and if they want to ask anything more, they will ask you. Okay. Similarly, laparoscopic surgery. So you should be thinking, what are the steps of laparoscopic surgery? So in laparoscopic surgery, people go and try to go in systemic. No, please. Again, the problem is that if you will go in that way, I'm not saying that is wrong. If you are able to answer, you can do it, but don't overdo it. Like not make always. I'm not saying that this is wrong way. This is actually the correct way, but don't overdo. Don't overdo. Laparoscopic answer should be in this second. Like there is the insertion of trocar, pneumoperitoneum, and absorption of CO2. So when they insert the trocar, there may be vessel or visceral injury. When they start pneumoperitoneum, patient, if the gas is going to inside any major vessel, it can cause carbon dioxide embolism. And when they do the pneumoperitoneum, it is just like a pressure effect leading to cardiovascular and respiratory insufficiency. Like there will be decrease in cardiac output, there will be increase in airway pressures, tube can go up. So very simple answer. Okay. And then the third step is the systemic effects of in absorption of CO2. So you will tell in that way that you should have a very good of anesthesia, depth of anesthesia when you are inserting the trocar, so that the vagal response will not come. And you should maintain a good IV fluid, good volume, so that the patient, when if any patient who has at risk of more instability, you should be managing accordingly. That like if you have fixed the endotracheal tube in a way that it can go endobronchial, so you should be ready for it. If you are giving a volume control ventilation, so be ready for increase in airway pressure. So similarly, you should be knowing. So this is a sample, this is a way how you have to construct your answer. Okay. And anesthesia steps, let me show you. I think it will be here. So please, I'm opening the drive. Please, can you, if anyone has got any question or any comment about what we have discussed up till now, if you will remain silent, you will, I will finish the discussion, and because I'm not taking a lecture, it is just a discussion of telling you the way. So if you will not speak out, I'm afraid, it's not the correct way. Please, if none of the people are volunteering. So let's open this surgical thing. So whenever you are thinking about any surgery, you have to know the reason why they are doing surgery, what is the urgency, any surgical risk, bleeding risk, and yes, a special patient position. So in laparoscopy, you know that what is the position. Okay. So usual duration, level of incision required, and level of anesthesia required. What are different types of anesthesia you need to do? What are the regional anesthesia options? So this is the surgical things. Okay. And any special requirement with reference to
Sir,
any.
Assalamu alaikum. Sir, I have a question, please.
Yes, yes.
Sir, I would like to ask that is it necessary to remember the steps of the surgery for every surgery,
Oh,
like laparoscopy or any other surgery?
remember one thing, not the steps of the surgery. You are anesthetist. You have to build up your own mosque. Okay. So you have to extract the things which are important for anesthesia. And you name anything, you will have some link. You name any surgery, there will be
Right, sir.
something like in appendix, for example, or any surgery in which they can pull the mesentery, there may be sudden bradycardia. Any surgery in which this vagal nerve is involved, there may be bradycardia. There will be any surgery in which vestibulocochlear nerve is involved, there may be more chances of postoperative nausea vomiting. So similar, like
Right,
they
sir.
don't
Sir, you
want
mean
you
to
to.
say that we need to remember only those steps of surgery which are related to anesthetic concerns?
Of course, of course. Okay, even this is more than enough. If they are failing you, if they want to ask what is the procedure of Whipple, I'm afraid this is not. But you should know that what is the surgery, what is the incision of, like if like I was being asked in one of the Viva about they were asking about tap block, so I was not good. So they were just to irritate me. They were asking what are different abdominal incisions. They can ask you such questions, but this is not the failure
Sir,
point.
I'm asking
But
because most of us do not focus on the steps of the surgery or rather try to remember what are the steps of
my
different
dear,
surgeries.
most of us, we don't focus on anything. That's why we get trouble in the Viva. Okay. So, so you should be knowing the basic steps of anesthesia, of surgery, which are related to anesthesia. Like in any orthopedic surgery, tourniquet application and removal. This is a critical step. Long duration of tourniquet, it's a critical step. Insertion of bone cement is a critical step. If suddenly there is bleeding, it's a critical step. okay, or anything, you go into each, and because in this file I have made a possible list of all the surgeries, okay. And don't worry, there are so many surgeries which are correlated, and actually we have discussed, the recordings are there in the YouTube. I have discussed all the various aspects of surgery, okay. So you can have a look, and you should be thinking what are it, like they can ask a question, make a question about it, about this gynecological TURP. I'm just giving you one example, okay. So it is just like absorption of fluid, okay. So this absorption of fluid occurs almost in a similar fashion which occur in TURP. So that's why it is called as gynecological TURP. Okay. So I'm just giving you examples. A little bit of surgical steps you should know, but don't think that they will ask you to tell all the surgery. It's not viva of surgery, it's viva of anesthesia. Okay. So I hope I answered your question. So this is
Sir, thank
with reference to this one, and then what I was telling you about the approach. So, when, as I mentioned, that's patient category, disease and surgery. Okay. So these are something which you should be knowing, that what is the main category of the disease, what is the main pathology, what is the mechanism of action of problems. Okay. And then how to diagnose a disease, how to evaluate various systems involved, and estimating the severity of disease. Now fit it in any disease. Okay. Fit it in any disease, that you should be knowing how to diagnose that disease, how to evaluate various system, any problems in that in that disease, how various systems are involved, okay, and how you estimate the severity of the disease, that it is mild, moderate, or severe, okay. So similarly, then, as I mentioned you, that our job is airway, cardiac, respiratory, okay. And why liver, kidneys are important? Because liver, kidney, and bone marrow white is important because liver is metabolizing the drug, kidney is excreting the drug or metabolizing the drug, okay. And bone marrow is related to our blood products like platelets or hemoglobin, okay. And this is the most important thing, the homeostasis, what I say at my best friend, high at like oxygenation, ventilation, volume status, rhythm, temperature. Okay. So these are what I just say by fun, that this is my best friend. Acid base status, electrolytes, fluid balance. So any surgery or any disease or anything, think about these things. That does it cause any hypoxia, hypercarbia, acidosis, any fluid imbalance, whether it in the form of hypovolemia or hypervolemia, okay, whether it is making any electrolyte imbalances, okay. So whenever you are reading any disease, make a format like this. This is just a default format. You can make your own format, okay, and then put diseases in this format. In that way, you will be able to learn in a better way. Okay. So now and then whenever you are evaluating a patient, or whenever they are giving you any scenario, now think: is there any cardiac risk? Is there any pulmonary risk? Is there any renal risk? Is there any aspiration risk? Is there any risk of post-operative nausea, vomiting? Any problems with reference to airway management? So now just think about it. If only we think about it, myasthenia gravis, you can put there is pulmonary risk because there is weakness. Okay. Renal risk or cardiovascular risk with reference to immunosuppressants. Okay. Aspiration risk because of bulbar weakness. UNV risk because of the medications patient is taking. Airway management risk, what's the problem? Whether it is form of ventilation, intubation, laryngoscopy, anything. So here there is risk of aspiration. So this is a problem that maybe you need to have modified rapid sequence induction or rapid sequence induction. Okay. And there is also another problem that the medication which we give for intubation, the effect is different. The variable, whether it is sensitivity or resistance. Okay. So this is just an example. And then very important, any special monitoring. Like you should be thinking standard monitoring will be there everywhere. Okay. Think about any special monitoring. Like in this patient, you can say that maybe we need to have neuromuscular monitoring, the myasthenia gravis, for example. Okay. If you expecting swings of blood pressure, you can have requirement of cardiac output monitor or arterial blood pressure monitoring. anything which is affecting the neurology, so you need to have neuromonitoring. So in addition to the standard 1 and standard 2 monitoring, your answer should be that in addition to standard 1 or a standard 2 and standard 2 monitoring, we need this. So whenever you are answering any question, think about it. Okay. So this is how you will just fill your chart, that any pre-medication needed. Yes, in this patient, we need to have acid prophylaxis. We need to have proper NPO. And in addition to that, we need to have acid prophylaxis, as I told you. Okay. Any special monitoring induction agent, any induction agent you specifically you will use or avoid. Okay. Any muscle relaxant you will specially use or avoid. What will be the challenges in maintenance of anesthesia, analgesia, fluid therapy, what and how much, and how to see the fluid responsiveness or how to see the fluid status. So this is the basic thing. And after recovery, whether would you like to send the patient to as a day case, you will not admit the patient, you will send the patient to ward, you will send the patient to HDU, you will send the patient to ICU, you will send the patient to ICU ventilated. So these are the things. Any patient which is coming, any scenario, please try to fill in it this format. If you are able to do, I can guarantee it for you that you will not fail. But for that, you need to practice before. Like your target, after listening to what I'm telling you, make your own small notes, or better written notes, better to have audio notes. Better to have small audio notes which covers all the aspects of a disease, of a patient category, and the surgery. If you are able to do it, believe me, it is just like if you are making some food at home, it normally will take much more time than when you are going to a restaurant. You are ordering, etc., 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 and they are bringing in 30 minutes. How they are bringing it? Because they have half cooked meat, they have half cooked chicken, they have cut spices and all the vegetables. They are just putting it and stirring it and bringing it for you. So it will save time. While at home, you have to start from the scratch. Maybe the meat is frozen. So you have to defrost it, and you have to cut everything, and then you are making, etc., etc. So this is the difference between half prepared answer and a difference between too much details. What we use word bakbak or girgir in Saudi Arabia, and bakbak in, and there may be some, I'm not able to find a proper word in English. Okay, so inappropriate words I'm finding a lot. So thing is that you don't have to do any stupid extra things because you have limited time. If you are not able to answer, the examiner will become irritated, and it is just like creating a mess of your viva. So you can only do it by practice. So practice is the most important thing, my dear. It does not matter how many books you have read and how many sources you have utilized. The important thing is that how you are preparing yourself for the exact scenario. Okay. So this is important thing. I've just made a format. So you are evaluating a patient on the basis of history, examination, and investigation. So the another big mistake which people do, they are saying, sir, I will take history, I will do examination, I will do investigation. No, you don't have time to waste like this. So you will say, I will evaluate the patient on the basis of history, examination, and investigation. And my approach will be that the patient has this thing or this thing or this thing. Very few words you have to tell. Like for diabetes, what you will tell? That on the basis of history, examination, investigation, I will see, is there any microvascular and macrovascular complication in brain, heart, and periphery, and the side effects of the drugs the patient is taking, and how is the blood pressure control, and how good is the patient. Okay, so this is your answer. If they want to ask in more detail, they will ask, okay, how will you evaluate the microvascular complication in heart or microvascular complication in brain or whatever? So sorry, macrovascular complication in brain. So you can tell further, and you should know the first next step. So if they are asking, you will say, I will do retinoscopy, I will refer the patient to ophthalmology, and they will see they will do the retinoscopy, and few things you will get from the history. Is there any visual field defects, or is there any problem in blurring or anything like that? And similarly, with reference to CNS, this neuro, how will you say there will be effect history of any motor, sensory, autonomic problem, or TIA or stroke. Okay, so this is how you can get. With reference to heart, there will be either chest pain, shortness of breath, high blood pressure, angina pectoris, like that. So this is how this will be on history. On examination, there you will find something, and then investigation you will do ECG, chest X-ray, echo, thallium scan, angiography, this cardiac CT according to the requirement, according to the condition. So this is your format. If you know the format, you will be able to understand. Holter, ambulatory blood pressure, these are all cardiac investigations which you have to use accordingly. Okay, so if you are trying to answer, you have to preform your answer for diabetes and hypertension, because these or any disease, if you don't know how to answer, it will be very difficult for you at that time to prepare your answer, and that's a problem. You people fail in Viva despite knowing everything. Okay, so this is the, so similarly, like I've told you, that on the basis of the status, disease status, you will see what is the risk, as I told you here, that you have to put, like for example, if any patient have any cardiovascular problem, this is at risk of cardiac morbidity and mortality. There may be swings of blood pressure, there may be intraoperative MI, there may be like pulmonary edema, okay, overload, like that. Similarly, if the patient is taking steroids, if the patient is taking NSAIDs, if the patient is having a surgery in which there is large fluid shift, if a patient is there is a surgery in which there is a lot of bleeding, a lot of hypotension, for example, so it can affect the kidneys. Okay, if any surgery or any procedure in which there is contrast, so these are all renal risk factors. So you have to chalk out pulmonary risk factors, renal risk factor, cardiac risk factors, PONV risk factors, as I mentioned. So this is a format. Believe me, if you make understanding of what I have told you, Viva will become very easy. But for that, you just need to understand what is it, and you have to practice for the format. Because no matter how much you have studied, if you are not able to identify the problems, unfortunately, you will not be able to answer. They will ask, how will you give? How will you give anesthesia? So if you know, you will be able to tell that I should have this monitoring in addition to the normal one. I should be giving, I should be taking arterial line in awake patient, so that I am able to have, I will not do rapid sequence induction, I will do a modified rapid sequence induction with placement of arterial line before I start, so that I have a better control, better observation monitoring, and better control of the hemodynamics. So this is how you will answer. This is how they would and try to tell a lot of things in pre-op. Like I have written here, pre-op, intra-op, post-op. The problem what the people do mistake, they are confused that this is purely pre-operative or purely intraoperative or purely post-operative. My suggestion to you, if you are able to plan your anesthesia in pre-op, you will not miss anything. Okay, so you can tell in a way that I will be expecting these things, so I will have post-op ICU. I will be expecting this thing, so I will have intra-arterial blood pressure monitoring. I will be expecting this thing, so maybe I want to send the patient to ICU, like that. As I'm telling you, so it is better to tell all the things in your anesthesia planning. Okay, I know that the ideal way, if you have so much grip on the subject, okay, you can divide in this pre-op, intra-op, and post-op. But I'm afraid you can forget. So it is always better to tell pre-hand. Like if you have a patient category of obese patient, so you will tell in pre-op that this patient will have problem in monitoring, problem in IV lines, problem in airway. Okay, maybe we need a special bed. We need more manpower to handle the patient. Okay, so these are simple things which you have to tell. So it is better to tell in pre-op rather than waiting. You are confused which thing comes in pre-op and which thing come in intra-op and which thing come in post-op. So don't overdo. Same is the problem with the system. If you think that it is difficult to identify the words of system, tell in a proper way, in a way that your answer is not disorganized and you are not missing the important points. Okay, so I hope you understand. So this is how you plan your anesthesia. So these two files can help you. Okay, so similarly, you should be knowing why you are doing various testings. Okay, because I am just giving you a bird eye view. I have limited time today. So I cannot cover each and everything, but I am giving you an idea how they will be asking. And then another thing which I will just tell you, that they will be asking any complication. Okay. No scenario will finish without they will be asking a complication in between. So what is the way to cover that thing? You should know all the possible complications which can occur in operation theater and prepare your answer for it. Like tachycardia, bradycardia, hypertension, hypotension, hypoxia, hypercarbia, increased airway pressures, pneumothorax, pulmonary embolism, and then all other different embolism, bone cement syndrome. You can make a list of the complication, and you should know malignant hyperthermia last. So any complication will come in these scenarios. Okay, if they are asking TURB syndrome, for example, it will be all about sodium balance. Okay, if they are asking about hypertension or ischemic heart disease, they can ask you about intraoperative MI. They can ask you about arrhythmia. They can ask you about hypertension, or any treatment of any like arrhythmia with hemodynamic instability. Okay, so I hope you are with me. Okay, so this is how one point is all the anesthesia problems, and sorry, all the anesthesia steps and any possible complication. So in any scenario or any disease, like in this scenario which we are considering, I have told you so many complications can occur. Carbon dioxide air embolism. They can ask you about this thing. They can ask you about vagal mediated bradycardia, how to manage it. They can ask you about like carbon dioxide narcosis, for example. Okay, and this is myasthenia gravis. They can ask you about delayed post-operative recovery. What are the possible causes and how will you manage? Okay, so this is how you will anticipate. Please, the best way only is that when they are asking you the scenario, try to write in shorthands in any of the paper in front of you. This is a very effective way. Number one, it looks good, but it does not mean that you will write each and everything. You just using your writing skill to scan the words in your brain. So you will just make a sign, like you can just you will make a sign like female or male, DM, hypertension, like that, 60 years old. So your brain will scan in this time when you are writing. It will not take much of the time. Okay. So when they are giving you a scenario, try to write few words about it. Okay. And this, in this way, you will not miss anything. You will not say what. Okay. So this is how you can handle a scenario based question. Okay. And in my previous discussion which I have done in, and they are all available in YouTube, because every time I am unable to cover each and every topic. But in last 2 to 3 years, believe me, I have covered almost all the aspects which can be asked to you in Viva. My YouTube channel is not a monetized channel, and I am not asking you to listen to them for any getting any benefit. Believe me, it is for your benefit. Spend some time listening. Listening practice is much more important than reading the books. You are reading everything, and in the oral part, you are not able to identify how to speak out. The time is finished, and then you are cursing the examiner. He was very angry. He was angry because you pissed him off, because you were distracted, you are telling nonsense, and he became angry, and now you are cursing him. No, you are the one who is responsible to get failed. I failed twice, I passed in third time, but believe me, I will never say that the examiners failed me, because I deserve to be failed. Okay, and if you are not able to understand why you failed, this is more big a dilemma. If anyone who appeared in the Viva and failed, and he does not know why he failed, and he's coming out and he is just like a typical problem man, he's just putting the blame on others. Oh, examiner does not like my face. Oh, examiner was not good. No, there are certain things which are variable and certain things which are constant. Constant is examiner. You cannot kick the examiner out of his place. Yes, you only have to change yourself. You have to improve your answer. This is a variable. You can improve your knowledge. No, no, this is one thing, but more important, your communication skills, how you speak out, how you are talking, how you are picking the problem. Okay, so I again repeating again and again, the purpose of this discussion, this is specific session, is to make you familiar to how to proceed with an answer. Okay, because scenario based question need more attention. So I will just repeat what I have told you up till now, that you have to identify the risk related to the to the surgery, to the disease and patient category, and then you will make cardiovascular, respiratory, renal risk, or anything which is affecting the anesthesia management. So it will be starting from all the pre-operative evaluation to the post-operative. So you fit in everything, and when they are giving you a scenario, your mind should be active, and you scan and they tell the things even in 1 minute. In the first minute, believe me, if you are able to tell everything before even they ask, you will not fail. You, if you start that I have this concerns, if you are able to tell, now you are passed, and rest of the time you can just utilize in a proper way. At least they will not fail you. I can bet on it, because unfortunately, yes, some examiners will interrupt you, but it will, your way how you are speaking out will identify or will guide you. So I know this is a tricky thing. You have to practice, practice, and practice. Otherwise, you will have problem. Okay. So the direct questions, about direct questions, they will ask you, what is this or what is this? What is abdominal compartment syndrome? What is pancreatitis? What is this? So these are, well, actually, this is not a difficult thing. Okay. Yes, nobody can teach you each right now all the things. It's not possible to read what you are supposed to read in 4 years in 4 days or 4 weeks. It's very difficult, but I will try. And actually, believe me, I have. That's what I'm telling you. That, like, for example, people, can anyone answer one, just to check it out? Any exam candidate who is listening to me, Wajiha, are you the exam candidate? Anyone? I just want to ask a question. Just, and don't be shy. If you will, even if you will answer wrongly, it doesn't matter. Who will answer? Nobody want to answer. It's not a difficult question. Please don't worry about it.
Sir, I will
Yes,
answer.
yes. Thank you. What information would you like to get from echo?
Sir, I would like
Uh,
to
Chalo,
check the patient's.
I give you an example, whether it is ischemic heart disease, hypertension, or valvular heart disease. So, what information would you like to get in echo?
Sir, regarding ischemic heart disease, I would like to check patient's wall motion abnormality and ejection fraction. And regarding valvular heart disease, I would like to check the valve areas and regurgitation fraction. And regarding pulmonary hypertension, I would like to check the pulmonary artery pressure.
Okay. So, just to, because my mind was stuck to one point which you said segmental wall motion abnormality, and then you said if ejection fraction. Is there anything else with reference to ischemia?
Yes, sir.
Is ejection fraction important?
Sir, important, of course.
Okay. What else is important? Have you heard of hypokinesia
Yes, sir.
or akinesia? So, did you tell about it? So, what do you mean by segmental wall motion abnormality? What does it mean? Segmental wall motion abnormality means that there is some ischemia going on. So some cells are deprived and they are not able to contract in a proper way. If it is becomes more, it will become hypokinesia, and if it is even more, it is akinesia. And failure will result in ejection fraction. So, believe me, usually ejection fraction is the last thing which will be damaged. When ejection fraction is decreased, patient is already gone. Okay. So with reference to ischemia, this is a sequence of events: hypokinesia, and then akinesia, and then this is ejection fraction. What about hypertension? People think, actually, I had made a discussion, and that the topic of discussion was things other than ejection fraction is normal, sir. Okay, so just tell me one thing. What thing is more important in hypertensive patient?
Sir, left ventricular hypertrophy.
Left ventricular hypertrophy. Okay, so how will it you define left ventricular hypertrophy with reference to hypertension in echo? Actually, it is the diastolic failure. Okay, in the echo report, you will usually not see this left ventricular hypertrophy. The main thing which you will be looking at is diastolic failure. Okay, and what is the concept of it? How? Because usually there are two phases. One is ejection phase and one is atrial contraction phase. So there is an E over A ratio. When the mitral valve open, in a normal patient, most of the thing will be ejected when the mitral valve open. Okay, and only the 10 to 20% will be with atrial kick. But if a patient is having diastolic failure, or if the patient has mitral stenosis on anything which is making this A more significant, this is become like E over A ratio will be changed. For example, normally it is more than 1. For example, I'm just giving you a number. If it is 5, if now E is decreasing and A is increasing, so this number will come back down. Maybe it will become 1 or even less than that. Okay. So this is how you will be identified. So this is the for diastolic failure, and the rest of the thing you have, some of them you have tell valve size, transvalvular pressure gradient, and regurgitant fraction. And then one very important thing is chamber clot, chamber clot, chamber size. Like what happens in mitral stenosis. Okay, there is a stasis and there is chamber clot in like LA, for example. Okay, so this is why it is important for us, because it can dislodge and it can cause embolism. Then the important thing is PA pressures. Okay, so you get a rough idea about PA pressures, not exact one. Okay, for what will be the next step if we have PA pressures? Next step is right heart cath. Okay, with right heart cath you will be able to identify the correct PA pressures, the effect, the exact pulmonary hypertension. Okay, but it will give you a rough idea. So this is, I'm just giving you an example. People don't know about echo and ejection fraction. Believe me, if it is normal, it has no significance. If it is like written more than 55, it does not mean that heart is all good. But if it is less than, for example, 40, it is significant, or less than 50. If like any value less is significant, any value more is not significant. So this is practical as well, that if you find any patient with normal ejection fraction, don't think the patient is normal. You have to check the other parameters. And the most important parameter is what I have told you. Okay. This diastolic failure and E over A ratio. So this example, now you have to put in all the investigations. You should be knowing what to learn in thallium scan, what to learn in cardiopulmonary exercise testing, what to get from ECG, what to get from this BNP, ANP levels, what to get from cardiac enzymes, what to get from this cardiac CT. So you should know few things about it. Okay, thallium scan, stress thallium will tell viable myocardium, whether, or you can say that you will get any perfusion defects. Okay, and this cardiac CT will also tell about the patency of the vessels. Okay, so similarly, the last thing will be angiography. The gold standard will be angiography to see any problem, and because it will tell any blockade or any clots or whatever. Okay, so from ECG you will see the rate, the rhythm, the RV, right ventricular hypertrophy, left ventricular hypertrophy, axis deviation, P pulmonale, any changes of electrolytes, any changes of any disease, oh sorry, any drugs. Okay, so this is how you will identify ECG. Similarly as X-ray. So all investigations, I'm just giving you one few examples. Now you will put it all, then you should prepare your answers for all the bloody investigations. Whether it is diabetes, you will see HbA1c, you will see random and fasting blood sugar, glucose tolerance test. Okay, and then you will go further detail retinoscopy, further detail ECG, and then again this all cardiac door will open, renal simple urine RE, corticomedullary differentiation in ultrasound, okay, and this albuminuria or creatinine clearance for diabetes, or even same is true for hypertension. Okay, in fundoscopy you will find this new vascularization, dot hemorrhage, blot hemorrhage, and like problems in the retina. Okay, so this is how you will identify the problems. So I hope you understand. Sir, for neurological, carotid Doppler is one thing which will tell you dynamic flow, but the gold standard is this CT angio. CT angiography is the gold standard, and then CT scan or MRI. Okay, and there will be certain, if a patient is at risk, you will be monitoring him more in the form of BIS, in the form of trans carotid Doppler, sorry, stump pressures, or as we do in carotid surgery, or we do this BIS or O3 monitors, which will tell you an indirect global hypoperfusion of brain. Okay, so why it is important, what I'm trying to tell you, that if you understand these things to start with, or if you don't understand these things and you are just trying to cram pages from any book, believe me, you will not be able to understand, because there are so many things which are common in same disease, different disease, the same things. So why don't you understand this thing, that any patient with liver, for example, liver, I'm just giving you a hint, liver dysfunction. So there is one synthetic function, there is one hepatocellular function, and one there is obstructive function. Okay, so ultrasound will tell you some things about architecture and everything. Okay, stones or any biliary or something you will get from it. Leading from that, it to like ALT, AST will tell you the hepatocellular function. Okay, synthetic function will be by PT-INR or albumin levels or globulin levels, for example. A over G ratio will tell you, and then further you will go detail, and it will even if you are doing thinking about tips. Okay, or you are uh, because this even the heart function will be affected by the liver, or liver is affected by heart. So things are correlated. So and my suggestion to you, my dear everyone, please try to understand what I'm trying to tell, correlate the things, and prepare your answers. You should be knowing why any investigation. So this will help you whether you are doing a long case or in table work. So another important point, that what is difference between long case and a table viva. We will have some more session about long case separately as well. But the basic thing is that in long case you have 30 minutes, and in table viva you have 5 minutes. Okay. So how can you convert the things which you are getting information in 30 minutes to how you can transfer in 5 minutes? So you have to understand this thing. And in long case, you have to do the history, you have to do the examination, you have to do an investigation. The result is the same. Believe me, the result is the same. The table viva, you are telling the result. And in the long case, you are finding everything which you are telling in table viva. So even in you are doing the history examination or an investigation, in your mind, it should be making the same flow as I told you. That what are the renal risk, what are the cardiac risk, what are the pulmonary risk in that patient which you are taking the history examination or investigation. If you understand this thing, that while you are asking the question, don't go in too much details. Try to understand what is the common thing. I will show you the paper which I have made for it. So this is what. Just a second, please. So whatever the demographic history, and then all common histories you should be knowing. Okay. Any personal habits or any infectious disease, because what is the importance of infectious disease? You will tell that this patient is a risk of spread of infection. So it is an occupational hazard. So you have to inform everyone that this patient has hepatitis or AIDS or whatever, any infectious disease. Okay. So similarly, you will find the significance of these things. So cram these questions in any patient. And now in long case, what is the difference you will be doing? If you find any specific history, you will go a little bit more detail. Okay. More detail, but don't forget to ask other questions. Even if you are seeing there is nothing, maybe you, in one or two questions, you will finish the neurological system. You will say, okay, neurological system is good, cardiovascular system is good, respiratory system is good, in that way, or is not good. Any finding you are expecting. So trying no, never forget how to take the history. People are, what people do are mistakes in long case is that they are trying to create the question from the questions or from the answers given by the patient. If you will do this, I can bet you will never be able to finish the history in 15 minutes. If you want to solve this problem, this is not a perfect thing. This is just my observation. Okay, so make your own, like any patient with cardiac problem, you should be knowing that whatever cardiac problem is, there may be chest pain, there may be shortness of breath, there will be any peripheral vascular disease problem or neurological problem. So in 4 or 5 questions you should rule out cardiac. Similarly for liver, like nausea, vomiting, diarrhea, and all other things which can be there in jaundice, this problem of abdominal pain or anorexia or weight loss or things like that. So make a list of problem based questions for all systems, for liver, for kidney, for heart, for ear, for nose, for everything, and the demographic questions. Make your own list, and whatever patient is there, make a note of the presenting complaint, ask about the how it starts, how it increase or decrease, what is the character of the problem, what is the medication you are taking, or any coexisting sorry, associated problems with that presenting complaint. So that will be one detail, and never miss it. Never miss the presenting complaint. Okay, never miss the presenting complaint. If you miss the presenting complaint, you will not pass. I can guarantee you that. It's more the people who fail in the long case, the majority of time they miss the presenting complaint. They are going in too much details, and they are not focused, so they are not able to finish their history. So again, I repeat, for long case, you prepare a paper for yourself in which you have all the questions related to all the body parts, and you should know how to interpret them. And if you find anything, you go in details for it. Ask the presenting complaint and then make some details of, like, complaint will be either some swelling, some pain, some shortness of breath, some, like, anything like that. So go in detail for that thing, but don't forget to ask other questions. Okay. So I have just made a sample for it, and you can make in details. So similarly, for examination, people are afraid from examination. Believe me, it's not difficult if you make it easy. If you make it difficult, you will never be able to finish it. So the basic thing is that you don't touch the patient well with cold hands. Okay. And you are treating the patient roughly. You are asking everything, you are telling everything. Like, I remember one time, because I appeared in 3 times. So one day I remember the patient was female. So I don't know how it slipped into my mind. I said, I need a female attendant. So I invited a problem for myself. My examiner was female, and she stand right in front of me. She stood and with the patient, and she listened all my questions. So as she said, yes, I am the female attendant. Okay. So I'm just telling you, these are the things which they are expecting from you. And then you can make your own plan for it. But the basic thing is that try to do the things in an order. Okay. Like if you want to see something in head, finish hand and go up, and then go to the axilla, and then go to the neck, and then go to the face, and try to finish the things which are there. So when you are opening the mouth, you can see the even you can see the 9, 10, 12 nerves as well. Okay, you can see the malam patti as well, you can see the dentures as well. So anything, when you are seeing the neck, you can see the lymph nodes, you can see the palpation, visible pulsations and everything. So try not to make the patient sit or stand again and again. Try to not to change the positions again and again. Like if you are expose the patient, you can tell ideally the exposure should be up to the mid thigh. But should I do it? They will never ask you to do it. If you have a female patient, they will not ask you to remove the shirt. So you will just say that ideal issue, but because of the social things, I will not be doing it. You can say like that. Or should I do it like that? You can ask, you can say like this. And then if you are doing something from the front, do the examination of thorax and abdomen in one go. And then you are making the patient sit. You can do everything which you are want to do in the cardiovascular system, respiratory system, even examination of spine and sacral edema and everything. If you want to see the legs, do the all things related to the legs. It is my way. I never failed in long case. Three times I appeared. I have two times I failed in table viva. Okay, so this is my way. At that time, maybe I did not have that level which I have right now with experience. But even at that time, I never failed because what I understood what how to communicate with the patient. Okay, so this is, and of course there are too many details. You can go in details of everything, but try to understand that you just have 15 minutes. What the hell you will do in 15 minutes? So please make your habit of even squeezing it down to 10 minutes. So you should try to finish in 10 minutes history and 10 minutes examination, and then next 5 minutes to extract the important things from it, from whether it is examination, whether it is history. And ultimately, before you go to the patient, you should, sorry, to the examiner, you should know why you are asking this investigation, number one, and you should know pre-hand, and you should anticipate what questions they are going to ask. So this is how this is the basic points how to crack your long case. Okay. So this is the basic thing. And again, I repeat, history, examination, investigations, anesthesia planning, anesthesia risk, systemic risk, and then all the anesthesia steps. This is the base point, whether it is long case or it is stable viva. The things are the same. Okay. And then complication. To explain any complication, the basic thing is airway, breathing, circulation. Call for help. My resuscitation and management will go side by side. I will look into differential diagnosis. So this is the basic answer. Whatever complication occurs, the same answer is there. And then any specific hypertension, this, malignant hyperthermia, this, local anesthesia toxicity. But you should make a list of all the possible complications and you should have answer prepared for that. Because complications will be asked in the exam. Whatever complication, even never events in anesthesia, any wrong drug administration or any extra physician or intraarterial injection, wrong site, wrong dose, wrong concentration, whatever, it can be asked. Any cardiovascular or respiratory instability problems can be asked. So the purpose of this discussion was to make you familiar how to approach your oral examination. And then very important thing, be confident. Don't look like a stupid and nonsense person. If you will look at yourself in the mirror before answering. So my suggestion will be that try to speak out in front of mirror. Try to record your video and see, do you look like a doctor? Do you look like a consultant? If you don't look like a consultant, don't expect that examiner will pass you. I have seen people sitting on the chair like a kyphoscoliotic. They are not even sitting properly. They are not looking at the examiner. They are facing as if they are dying. They are feeling as if they are cancer patients. So if they will be looking like that, just tell me why the hell examiner will pass you. Be confident. Maximum what will happen? They will fail you. Okay, no problem. Be ready for a failure to start with. But the time which you have, try to utilize in a confident way. Even if you don't know one question, don't worry about it. Go to the next. Don't you should not have a like a few days ago I was asking and that person said that examiner was not happy with me and they were making face and they asked me tell me what is written in Morgan. Okay, maybe they will say this thing. It does not mean that they will fail you only because of this thing. But that person or that lady took it on the heart and she became so depressed that she was not able to answer. So please remember one thing. You will not fail on one question. You will not fail on a stupid question. They ask this thing and they fail. Or oral tumor is something which so many, they asked about oral tumors and failed me. No, not at all. Oral tumors is not for us. Even if they are asking in the exam, if you are giving Viva in Karachi, they will definitely ask you about pan, BD and oral tumors. But does not mean that if you are not able to tell the types of oral tumor, they will fail you. Not at all. I can bet on it. This is not the year. This is just checking of your nerves. How sweetly or how confidently you handle this question. If you have forgotten. But I think whenever you are going to Karachi, you should prepare for these questions. Okay. So please, please, please don't don't feel as if you are uh, going to do something out of the world. Be just what will make your performance better, pre conditioning to yourself. And that can only occur that next time when I take a class, please, I would like people to speak out and I will just guide you the answers. Okay. So I think I will stop here and we will try to continue our discussions. But please, my request is that, first of all, if you want to discuss any question, please, you can drop a message for me to prepare that question. But I will request you that I have done so many topics before. And if you start listening to them, I will not become a billionaire. It is just for you. Okay. And if you spare out some time, you will go here in the contents and you will find the playlists. Okay. I actually shared the playlists to the people in the group. Okay. So any one of you want to have a look and you can say, like, for example, if you decide to discuss about endocrine, you can open about here in that, like, cardiovascular system and this one, Viva practice. Okay. So I have done a lot of things about Viva prep scenarios before. Okay. So you can open any of the link and you will find so many things. You just need some time to listen to them. But if you want to get benefit, you will be benefit. Like, for example, I'm opening this thing. This is the first thing. For example, this one. So I have discussed in detail like about investigations. Like I have given you a hint. If you want more details like that, then I have made discussion the common things which are always asked: pediatric patient for anesthetist, pregnant patient for anesthetist, renal disease patient for anesthetist, liver disease patient for anesthetist, respiratory disease patient for anesthetist, cardiac patient for anesthetist, positioning related concerns, optimization and anticipation before surgery. These are very, very important discussions. I know that does not look very attractive, but if you understand, same thing will come in any cardiac patient or any disease in which cardiac involvement is there, any disease in renal involvement is there, any pregnant patient, so this is the most important folder. Okay. So if you understand this thing, you will get benefit. So this is because my main, you can say, plea. This is the most important this folder. Okay. Similarly, like in some of the other discussions, yeah, this is also very important. Complications, okay? Because no Viva will be finished without asking about a lot of complications. So I have discussed the basic format of how to handle complication, and a lot of complications I've discussed. If I have missed anything, because I just try to, I'm speaking spontaneously. I'm not making a presentation. I'm just, whatever is coming from my heart. Okay. So I tell you something, you will find so many sources, books, and there are so many people who are organizing courses. Yes, they are beneficial. Okay. But I tell you something, trust yourself more than anyone else. I am just giving you a hint. I'm just giving you a format. If you understand that format, you will pass. Of course, knowledge is required, but knowledge comes alongside this format. If you know a lot of things, but you are not able to speak out, just tell me what is the advantage of that much knowledge. If you know 10 points about some disease and you are not able to speak out or organize your answer, an examiner is failing you, what's the advantage? Just tell me. Okay. So, inshallah, I will try to, anyone who wants to discuss the scenarios, like from tomorrow onwards or whenever I am getting the time, I will be trying to discuss the scenarios first. Okay. And I will try to cover the systems in that. So, like in this time, what I'm trying to start is through the scenario based. So we will try to discuss various scenarios, and in those scenarios, we will cover one disease, one surgery, one thing. Okay. But before that, if you listen to that playlist which I have told you, it will help you a lot. Okay. So thank you all of you for attending. And
Sir, finally, I have one question, please.
yes.
Sir, I would like to ask that how much knowledge is required for SCTS part two? regarding ICU and pain management, especially.
This is a question which I have no answer. Okay. What do you mean by how much knowledge?
So I mean that there are some specialties in ICU and pain management, but in general anesthesia, what kind of questions or what kind of
Basic,
scenarios do we have to?
basic. Remember one thing. All patients from all the diseases become serious, they became ICU. So this is one part of ICU. Okay, like pregnant patient has hypertensive disorder, PIH, become ICU. A pregnant patient with severe bleeding going in DIC became ICU. Okay, similarly, you will go in each and every system, you will find one part of ICU. Okay, then common diseases and common problems in ICU. Okay, so ventilator related problems. So I remember one thing, there is no pure answer for this thing. Whatever topic they're asking, you have to answer that answer question. So I don't think so there is any domain you can say that I can be. Yes, there are certain questions which are more common to be asked. And I have discussed again, if you have asked about ICU, again, I will tell you, please, you will have to spare time. And I have only this conflict of interest that my channel is not a monetized one. Listen to ICU. I have discussed in detail what are the things important for ICU. You will find this here. Okay. The common approach of a patient in ICU, like you will find here in this reviews. I have discussed almost everything. If I have missed anything, you can tell me. I will discuss the basic knowledge. Again, the answer to your question is the basic information. Okay, the basic information about anything, it can be asked. Pain, what is the pain pathways, how to assess the pain, what are different modalities of acute pain and chronic pain, what are the problems in chronic pain, different types of chronic pain, neuropathic pain. They can ask you anything. Yes, their answer question will be within 5 minutes. How much they will ask? Like you will be surprised. One time they asked me, which I had no idea, that was palliative care. Palliative care. I had no idea whatsoever about it. And it was part of pain. It is part of chronic pain. Okay. So, but doesn't mean that you cannot answer. If you understand, I have discussed pain a lot. I have discussed ICU a lot. And for that, you just need to listen to them, because I will try to cover as much as possible. But the thing is that this is years which I have spent. How can I just tell me one thing? Even if I take classes daily, I cannot teach you everything which I have done before. But I will try. Whosoever have any question, I'm asking you open invitation. Whatever you want to discuss, let me know. I will try to answer. If you are reading something and you don't understand anything, please feel free to ask. I will be very happy to help you. Okay? Okay, Sayyid Shah, SM Shah. Okay,
Thank
so
you so much, Jazakallah.
thank you all of you for honoring me to attend, and stay in touch. And inshallah, we will have some more session. But again, I'm requesting you to spend some time to listen. I have worked really hard to explain these things, which I have tried to explain in 1 hour. I was not able to tell everything. Okay. So thank you very much. See you inshallah tomorrow.
Thank you so much, sir.